Hi everyone, welcome to the International Dentist Podcast with me, Pallak Razdan. I have with me today a very special guest that I will let introduce from UCSF.
Hi, my name is Lydia Erickson, and I'm the Program Manager from the Office of Career and Professional Development. Thank you so much for having me here today.
Thank you so much for being here with us. And I know that we've been talking about doing something like this for mostly for like international dentists outside, whether they are like dentists already or, looking to join UCSF for their dental program. So this is great. Thank you so much for taking our time and being with us here today. So I guess the first question that I want to start off with you is like, what has your experience been and what brought you to UCSF? And, how have things been with school and with students and in dentistry specifically so far?
Yeah, so I'll start out with that first part of what brought me to UCSF. I started out my career in education, but realized a few years into teaching that what I really enjoyed was helping individuals grow, achieve their career dreams. I went to the SFSU Masters in Counseling program, which, as I mentioned earlier when we were chatting, is the only CAAPID accredited program for career and college counseling.
Wow. Okay.
Not for college counseling, but the only one for career, which is actually where my supervisor, Anna Reeves, went as well. And I was drawn to UCSF for a variety of reasons. I think one of the really great things is my team. It's just a very intentional group of people, very much a group of people who are kind of constantly piloting new things and just very supportive. And of course, we get to work with the most wonderful individuals, the most wonderful students. I kind of think of it as helping the helpers help.
Helping the helpers help.
Yeah.
You like that?
Yeah. But yeah, I think in terms of the dentistry students, we've really enjoyed our collaborations with them. I think, especially the dental RCOs are some of the most active groups on campus. So like this past year, we've had, another successful Meet the Dental Residents mixer. So if you haven't come to that yet, definitely feel free to stop by if you're interested in residency.
Yes.
And we actually did our first Meet the Dental Practice Owner panel, which was wildly successful. It sold out in like 2 days. We got residents there, and we actually have an FAQ on the website if you're interested in starting your own practice.
Which I will link.
Yeah. So I think it's just, of course, all of the groups, all of the populations at UCSF are my favorite. But, the dental students, maybe. Oh, no.
Yay!
Who can say?
Okay, amazing. So thank you so much for sharing your experience. And it does look like you come with like a wide variety of like, not just like experience, but also, so many qualifications and everything to back you in your position. So that is amazing. Thank you. And I feel all the more privileged knowing all this, that you're taking our time to speak with us. So thank you again for that. So I guess I want to, take us down the path of school applications because, specifically for IDPs, this is an application time. I think by now, most people have probably already submitted applications, but the whole purpose of this is to put it out there so that anytime anybody needs some sort of guidance or some sort of reference, it's available online. So I do want to chat with you a little bit about, I know there is a difference in how international students present applications versus domestic students and how they, submit their applications or curate their applications. And so I want to sort of just run parallels between what the differences are, whether that's in terms of language, the kind of language we use, the way we sort of formulate our thoughts on paper, specifically with respect to like letters of recommendation and our CVs. Sometimes, I like personally, I have a couple of applicants that reach out to me to review their materials before submitting on CAAPID. And, some of their resumes are so long, they're like 3-4 pages. And I know for a fact that that sometimes adds to like a lot of administrative burden because it's hard to review a candidate that has so much experience where you're trying to filter out what is relevant to the program versus what is not relevant to the program. So if we could just talk a little bit about, the differences and what would be ideal, like what an ideal maybe LOR or CV would look like.
Yeah. So I think in terms of applying to dental school itself, folks at admissions might be the best people to speak to. But I can speak to, cultural writing differences on a very basic level. I can speak to CVs versus resumes, what to include there, and also that kind of piece of how do you craft a narrative and what to highlight. So I think in terms of that first piece of kind of maybe cultural differences in writing. One of my earliest jobs in higher education was when I was a student at Boston University. And during that time, I was a writing tutor, mostly to international students, since it wasn't like a position especially aimed at international students, but they just had the highest utilization.
Right.
And one of the things we were trained on is what are cultural differences in writing. And so one of the main arguments that was made by the program, and this is definitely like overarching, very, very general, not going to be true 100% of the time. But a lot of cultures, like from like Germanic language bases, were very direct in terms of the communication. So it's like, okay, it's like you're writing an essay. You're going to tell them what you're going to tell them, then you're going to tell them, then you're going to tell them what you told them. And that's very similar to how we suggest you write like a letter of intent or a cover letter. And then, they were comparing it as well with like Romance languages. So I actually spent a semester studying in Spain, and the writing conventions were completely different. So it was all about like, how much can you get on the page, rather than like this kind of much more direct, like, step 1, 2, 3. And that was to show this breadth of knowledge. And so I remember in the original like instruction materials we got for this tutoring role, the Germanic language was like an arrow. And the one for Romance languages was just like a back and forth zigzag. And then I think this is definitely like very much an overgeneralization, but they just did a circle for like the kind of Asian languages, where the idea was you were a little bit more indirect because, you didn't want to insult the other person's intelligence by kind of telling them something so obvious. So, when I was an English teacher, that was something where I would kind of work with students on it. And basically taking, how do you write a topic sentence? How do you do like, how do you integrate evidence? How do you include this kind of more reflective part? And that's something that I do think folks will be applying as they're preparing their application materials.
That is true. Sorry, just to sort of briefly interject. Again, the number of application materials that I have reviewed, whether that's statements of purpose or like letters of recommendation, I have seen, as you mentioned, like a circle, because I feel like at least back home where I'm from, directly putting your achievements out is not considered it's not encouraged, right?
Yeah.
It's not considered respectful. And I guess that's where also we get that knack of, okay, let's downplay this, but at the same time, walk around it to build a story. But what we sometimes don't realize is when we're applying to professional schools like dentistry, we'd much rather be direct, especially with the US.
Yeah, yeah. And I think a lot of what we see with like interviews, because we'll do mock interviewing with students, is especially with women and folks of color. Folks are often socialized to downplay their achievements.
Yeah.
And so I think one of the easiest ways to kind of circumvent that is by focusing on the facts. So like, because of my efforts, the team was able to achieve X thing, or I got this positive feedback. Or just focusing on the impact you had in the world. It is hard though. We notice, especially with medical students, but I think all across the board, that when students are first answering questions during an interview, some folks have probably heard of the STAR or the BAR method. That's the way that you frame your answers to behavioral questions. So it's background, action, and then result.
Yep.
Usually when folks are going through that the first time, they use we a ton when they're getting to like the action stage and the result stage, because students on clinicals aren't necessarily like making all of the big decisions. They're still learning.
Yeah.
And so a lot of what we switch is like, okay, what did you do? How can we emphasize the I? How can we make you the protagonist in the story?
Yeah. It's funny you spoke about the STAR method. I actually recently did like a reel on explaining the STAR method and how that helped me crack the Kira interview for UCSF. So yeah, definitely. Like, I think focusing and pivoting on highlighting ourselves, highlighting our achievements, like there's no harm in putting ourselves out there in a more direct fashion. We don't need to beat around the bush. I think just that perspective shift makes so much of a difference in the quality of the application, right?
Yeah, yeah. And I think one thing that we see being very one way to strategically position yourself across different stages of the application is by figuring out like your top 3 superpowers. So maybe it's research, maybe it's volunteering, maybe it's leadership. And then you can kind of create bullet points around that, create section headings around that in your CV or your resume. You can use that as a way to figure out which stories you want to tell during the interview itself. And then the last piece is kind of your why. So, like, what motivates you, what keeps you going? And I think that's one thing where it can give you this unifying thread through every different stage of your application.
That is so interesting. Like, what you just said in the last 1 minute is like so much to unpack. It's a powerhouse of information. I think if we can just build on that. So sorry, please.
And we do have recorded recorded video series on interviewing. And
so we spoke about the video links, and I know you're going to share those resources with me, so thank you so much. And I would share those resources with my audience as well. But just sort of deviating a little bit, CVs, and what do you think is important to put on a CV with respect to experience? Where do we draw the line? Where do we, especially if we don't have as much experience in the US? Because I know that at least for international dentists, of course, we all have like dental experience back home, but then also some of us will move over to the US and try to shadow or even work like non-dental jobs. Because sometimes situations demand that and we need to make ends meet. So would you suggest we include those kind of experiences on our CV? Should we leave it out? What are your thoughts on that?
Yeah, so I think, as we're thinking about folks who are applying to dental school, I again would defer to the admissions office just because they'll know better than me what folks are looking for. I think at the same time, if you're trying to emphasize the right skills for getting into dental school, and if we're working on kind of any CV generally, what I would consider is how to make your experiences as relevant as possible, how to translate your experiences for the new role. So let's say you have no clinical experience from your kind of previous country. We'd be thinking about, with the jobs you have done, how do we highlight like your leadership skills? Do you have research experience? Do you have service work? What health experience do you have? And then we'd be trying to highlight that in the document. If you do have clinical experience, I think it can be kind of tricky because, if you wouldn't be able to do like certain procedures at the same level of education in the United States, then, we don't know how the person in admissions might react to that. So I think it's good to like speak to someone in your specialty area, see like how they would react. Just because, there can be really big differences. One piece of feedback we got from a student who was an international student with a fair bit of clinical experience in, a few different countries, was that when he was doing the residency application process, he actually got kind of penalized for mentioning all of his clinical background.
Wow. Okay.
Because they kind of wanted to be able to teach him from scratch almost.
Yeah.
And because he was transitioning from like one area in dentistry to another area, there were also kind of challenging questions about that.
Right.
So I think whenever there's something on your document where you really want to include it because it's like very important that they know you have these clinical skills, but you can also anticipate a question coming down the line. You just want to be able to answer that and to be able to kind of both address the concern behind the question and also be able to strategically pivot to something you'd rather highlight instead. We can definitely talk more about that. But I would definitely chat with someone in your area and just make sure that whatever the clinical experience is that you're trying to highlight, it wouldn't raise any red flags for an American dentist.
Right. So at least try to compare and be at the same level.
Yeah. And, again, deferring to admissions, deferring to dentists.
Yep.
But I think if you don't have clinical experience, then the question you're asking yourself is like, what are your top 3 superpowers that you most want to highlight? And then how can we make this seemingly disparate experience very obviously translate into the new role? right? So I know that you and I had chatted a little bit about our previous work in retail.
Yep.
And anyone who's worked in retail knows how to deal with a distraught client, an irate client. And so it's just the question of like, how can we use language that shows just how easily your work dealing with someone who is very angry about like a particular price or something would also translate to like comforting a child who you are doing, dental work on. So I think there's lots of ways to make it really obvious how the skill set transfers.
So I think, yeah, a lot of people always ask me this question: should we include non-dental experience? Should we not include non-dental experience? And at least my advice so far to them has been, it does show a holistic sort of personality. It shows like if you managed people, that goes to show how you would manage your practice in the
Mhm.
future, or like, have people under you that work for you. And so it's definitely a plus, but it also depends on how you frame it and how you're able to take transferable skills from one position and highlight it to show what it would be like if you were in a dental setting, for example.
Yeah. So I think a lot of people tend to naturally prioritize their kind of paid working experience when they're applying for something. But if you're applying to dental school, it might actually serve you more to just to highlight the most tailored experience. So, service work, leadership, research might be higher priority than working experience, even if the working experiences were meatier, just because all of those things can more easily be tailored to dentistry.
Right.
So you might change the emphasis a fair bit to match what they're looking for. And within those working experiences, you'd be thinking about, what are those top 3 superpowers and how do you figure out the kind of sub skills? So like if it's leadership that you're trying to emphasize and you're trying to figure out how do I make my Starbucks barista manager role transfer to this, you'd be thinking about, okay, what are the sub skills in leadership? Am I showing that I'm a good communicator? Am I showing that I can demonstrate initiative? Am I showing time management skills? And then you're mapping each bullet point to a particular transferable skill.
Right. I think that is like such great information, just because we sometimes tend to downplay all these things. We're like, oh, I was just a manager at Starbucks. Oh, I was just like an assistant associate. Like really downplaying. You have to be able to take what you learned in that position and how you were able to grow in that position to apply it to what you want to be doing now with school. Right?
Yeah, I think a big part of working on your application is figuring out how to give yourself credit.
Yeah.
So give yourself credit and don't leave anything on the table. Were you selected for this research scholarship? Great. Let's use that language and just, there's lots of ways to kind of humble brag on your document. And I think it's very easy for people to downplay their own accomplishments because they were the ones who did it.
Right.
So it's just a matter of figuring out what is the skill or, what helps set you apart.
All right, that was amazing. Thank you so much. Just want to now deviate a little bit over from CVs to letter of recommendations. Again, I have been seeing a lot of letter of recommendations where, because sometimes you have to write it yourself. The dean is busy, your faculty is busy, or the dentist you're working with is busy. And they're like, you know what? You write the letter, I will proofread it and sign it off on your behalf. And then sometimes what happens is, we tend to write letters for ourselves in a way that, we're really pushing ourselves, where we're like, oh, I've worked with X, Y, and Z, and she is the best international dentist to walk the face of this earth, to have worked in my office. And sometimes that comes across as a little too much.
Okay.
And you're like, I don't know. Like, are you able to vouch for the authenticity of this altogether? So just keeping that in mind, what do you think is the right way to craft a letter of recommendation, especially with language?
Yeah. So I think, with this, I kind of circle back to our cover letter format, and, the kind of 5 paragraph essay format that folks are probably familiar with from high school and college. And I would even start with our worksheet on cover letter writing, or we haven't posted this on the website, but we do have a how to get ChatGPT to write you a cover letter. We have a resource on that. So I'm happy to send that your way
Yes,
if you'd like to,
please.
if the letter of recommendation has been delegated to you, you can delegate it one step further,
Yeah.
at least for the first draft. But in general, I would say that first paragraph is your introduction paragraph. So you want to tell them who you are, your educational background. You want to mention why they're interested in this particular opportunity. So it's all about establishing fit. Why them? Why you? And then we get into your thesis, and we're mentioning like the top 3 things you can offer. In terms of the paragraphs themselves, I would relate those to your superpowers. So like these are the different areas where you're especially strong. But I would also think a little bit about like how to establish interest in the opportunity itself. So you could think of each paragraph as like, okay, topic sentence, one meaty anecdote of a thing you did especially well that is highlighting transferable skills in the process. And then the reflection piece at the end of the body paragraph. So that's going to be, what did you like about it? What you learned, how that's going to help you contribute to this new role. Then for the conclusion paragraph, and I think, there's also kind of an optional third paragraph, third body paragraph where you might talk about like your long-term goals or your why, or you could just focus on strengths. But once you get to that conclusion paragraph, you're kind of reiterating your, again, restating both, what you can offer and why you're interested in the site, and then you're indicating interest in next steps for a cover letter at least. So you'd be kind of modifying this for the letter of rec to probably just finish on that piece of what you can offer. So I would just start with like how you write a cover letter or an LOI, and then just tweak it slightly from there.
So just to sort of very briefly translate this into what it would sound like ideally on paper, I'm going to take my own letter recommendation example that I remember.
Yeah.
So for example, what I had written for my dentist was, Pallak comes to the office early. She likes to get set for the day. She'll take a look at the patient charts, make sure everything is ready for them. And I remember one time that, we had a patient where I thought we had ran out of a specific impression material, but she had already taken a note of that and it was available. And so that helped us save time and also get the procedure done more efficiently. So would that be something, would that look like what we had discussed?
I think we could talk you up a bit more. I think, I think in the kind of spectrum of how kind of intense the language is, with, point A being like Pallak is the greatest dental student in the world.
Oh my God.
And point B being like Pallak did this and it was very efficient. We can move further up. Let me see actually if because I wrote a recommendation letter for it was a PT student, so we'd have to do some kind of translating.
Yeah, of course.
Here we go. So this was for a PT student.
PT is physical therapy.
Yes, and they got the scholarship. And maybe it is more flowery, but dear scholarship manager, it is with great pleasure and no reservations that I recommend career
XYZ.
name for the physical therapy. Insert scholarship name. We're going to keep it anonymous. Career Peer is a third-year DPT student, and I've had the privilege of supervising her in her role as a career peer with our office, the Office of Career and Professional Development, since X time. As a career peer, she does X, Y, and Z, so I go into that. I won't repeat it here just because it won't be applicable in your case. She is a credit to her profession and has been an incredible asset in our work.